What is a cavity? Hi, my name is Dr. Muhammad, aka the Tooth God. I was here watching this funny video. It's actually an AI generated video I saw on TikTok. It was about this little kid's tooth that gets engulfed by this cavity monster, and it really sparked an idea for me based on a lot of questions that I get from patients, which is simple. What is a cavity? Here I'm going to try to educate my community on dentistry and all things in between. What do dentists mean when they use the term cavity? What causes it? How to treat it? And what does the word mean? I think we all generally have an idea of what we feel like it is, but what we feel or think it is can be a little bit different from what it actually entails, and it may bear some fruitful information for you just understanding the whole dynamics behind it. So without any further ado, what is a cavity? A cavity just means, it's defined by the dictionary, Oxford Dictionary, as an empty space within a solid subject. So of course we have a cavity in our chest, our thoracic cavity, and a bunch of different cavities all throughout the body, which are just these little spaces. And so why do we call or refer to teeth that have an issue with them as cavities? When we're talking about a dental cavity, it's kind of a similar sentiment. A lot of times what will happen in the tooth is it will break down and formulate a hole within the tooth. And sometimes you can't notice it from the outside, but we'll get more in depth in that process in just a second. But I just wanted you guys to understand that the reason why we use cavity in the dental terms will become pretty obvious to you when the formation of the hole happens, even though not all cavities are visible holes. So sometimes a cavity is so big and pronounced that we can literally see a cavity, as the word suggests, self-explanatory, but many times they're not. So I'll give you a couple of examples. Here I'm gonna have on the screen showing some cavities in between teeth. So they have the title superficial decay, but the main thing I want you guys to look at is we can look at the cavities forming in between the teeth on an x-ray. So this is an x-ray. If you see these little dark shadows which break up the more white shadowy substance, that is where you know it's a cavity in the area. And so we have arrows pointing to it, some bigger than others, little red boxes around others, but it's showing dental cavities. Now, why I want to show you these are because this type of cavity you most likely would not see in the mouth. You would not see it in the mouth, nor would you feel it in the mouth. So that answers a very common question. Can you feel cavities? And most of the time, no. Unless it's a very deep cavity, usually people cannot feel it, even though it's possible. At least not in a significant way. Sometimes if you have a cavity, one sensation that some people report is when you eat sweets, there's a little bit of an achy sensation, but it's usually not something severe, significant, keeps you up at night, anything like that. It's just a little bit of sensation after you eat something sticky or a sweet or something of that nature. That may be a symptom of a cavity, but for the most part, cavities are usually largely asymptomatic from self-reporting by the patient. Now, that is a far cry away from a cavity like the one right here, which is a big blown out tooth. You can clearly see the physical hole in the tooth. Of course, that's an obvious one. You don't need to be a dentist to diagnose that. A lot of times we'll live in between both of those areas, something that's not completely undetectable, but also not something that jumps off the screen like this big blown out tooth. And a lot of them that we'll see are these little small defective restorations in between. And what I mean by defective restoration is this is a tooth that's been filled before, which you can see a cavity here. You can see these little discolorations that you see right here. But before we go any further, I'm talking about cavities, what they look like and whatever, but I still have not answered my initial question. What is a cavity? So what a cavity is permanent damage done to a tooth done by tooth decay. Okay, very important, caused by tooth decay. Okay, and so it starts on the outermost layer, this little tooth decay. It starts spreading within the tooth, and when it gets deep into the tooth, it goes into the area with the nerves and starts infecting that area and you start having pain, and we have to do something else. But typically, we call it a cavity before it gets super deep. As long as it's not super deep, then we can consider it a cavity. Even though usually when the cavity only exists very superficially, like on the enamel, we usually don't refer to it as an actual cavity, though you could. Now, what causes the tooth decay or cavity? The cavity is tooth decay in layman's terms. It's kind of what we're talking about. I know we said a cavity is the hole that results from tooth decay, but a lot of times we refer to the decay itself as caries or the cavity for layman's terms, even though it's not the hole itself. So what causes this cavity phenomenon? I want you to answer that first. So I'm gonna put a little quiz on the board and I'm gonna ask you, which of these elements do you believe directly cause dental cavities? You can pause the video, give yourself like a 10-second timer if you want to. All right. Well, if you answered acid, you would be correct. Okay, so now if I show you this diagram, you'll see this little Venn diagram where this overlap and it's showing a bunch of different factors. So we have time, which is a factor, acid, which was the direct cause, sugar and bacteria, and when they all merge together, they form a cavity. And this is true. A practical sense, you need all of these factors together to form a dental cavity. However, why the answer is acid and not the other ones is because acid is the only direct cause of a cavity. Because if you have any of the other factors without the presence of acid, you will not form a cavity. However, if you have acid in the presence of a tooth without any of the other factors, you can still generate a cavity, which is what we see here. So we have this decay equation, which you see sugar from something that we're eating, the bacteria, which are going to populate our teeth always because they just exist in nature. They will produce acid, and we'll get a little bit more into this. Or we have this other example where we just have simple acid on a healthy tooth, which causes decay. So examples of these are people like with acid reflux. So if you have acid reflux, you throw up a lot, anything like that, or a very acidic diet, if you were to for some reason to drink battery acid or suck on lemons, which is a more practical sense, you would still have this result of tooth decay even without the bacteria or sugar needing to be involved. So acid directly causes it. The other factors just help with the production of acid to speed up the decaying process. So acid directly causes cavities. So the type of acid we're talking about is lactic acid. Now, lactic acid you will find throughout the body in different processes. Lactic acid comes from the bacteria. There's different ways that we can take food and turn food into energy. I don't want to bore you guys with chemistry details, but if you ever learned about glycolysis and all that stuff, it's basically the process that we do as humans. We eat food and then we convert that food into energy. In that conversion, there's all types of byproducts, but we don't really concern too much about those because all of them are pretty much beneficial for the body and help us do other things. We kind of recycle them to be efficient. However, when other organisms sometimes do this process of turning food into energy, the byproducts they produce are not always beneficial to us, and one of the times we see this is lactic acid. Now, bacteria are not the only people who can produce lactic acid. We actually produce it. So lactic acid is also the thing that kind of causes that burning sensation when you're using a muscle. So if you're in the gym and you're bench pressing a whole lot and you get to that last set and you start to feel the burn after a while, then that's lactic acid buildup. That buildup is because you have to go to this other energy pathway when you don't have a lot of oxygen because you used it all in that muscle area. And so therefore now, instead of doing the regular byproduct way, which is not as harmful, that regular energy production pathway that I was referencing a little earlier, we have to go to the bacteria type of energy production because, you know, they only use the small amount of energy. They don't need oxygen for that. So when we lack oxygen, we go to this as our plan B. And we go ahead and produce lactic acid, and you can feel the burn. That's one. The lactic acid fermentation is also used in a lot of food production. I went to this website. It's called Savory and Sour Test Kitchen, and they were talking about how they produce different foods, and they were talking about how lactic acid fermentation is one of the processes which make the foods like cheese, yogurt, sauerkraut, Brussels sprouts, and things of that nature. They use that bacteria to produce acid, which helps in the fermentation process of those type of foods so that we can enjoy their soury, acidic type of flavor. And another type of fermentation you can see is alcoholic fermentation. They referenced in when you use yeast. So when you give sugar to these certain type of bacteria, they produce lactic acid. Just like if you give sugar to yeast, they produce alcohol. And that's another way we produce alcohol. That's that fermentation process. So this fermentation process producing acid, okay, is how we get, cavity.